A time comes in the life of every race when people are driven by echoes of the past to chart a course for an exalted future. Africa is a blessed threshold, as major actors in the Africa arena plots a renaissance towards common destiny. Let's pedal across the streams of yesterday, through the backstreets of Africa, to the defining roles of policymakers, the political realities of the African nation, balance of power, and the strive to sustain national interest and identity. Join us on Network Africa on Channels Television. Network Africa, the rallying point for the emergence of a new Africa.
Hello and welcome to our first December edition of Network Africa with me, Cynthia Are. Now we begin in Kenya, where the President Uhuru Kenyatta has replaced his interior minister and police chief following a massacre by Islamist group Al-Shabaab. The President asked Kenyans to unite and said, quote, "We will not flinch in war against terrorists." Kenya's police chief, David Kimayo, stood down while Interior Minister Joseph Olenku was dismissed.
With scenes like this, it is clear why the Kenyan President Uhuru Kenyatta opted to replace his interior minister and police chief following a massacre by Islamist group Al-Shabaab in which 36 were killed. The Islamist militants killed the non-Muslim workers in northeast Kenya on Tuesday, prompting the president to change his top security officials to tackle a relentless wave of violence. Public pressure has been mounting on Kenyatta to sack Kimayo and Interior Minister Olenku since last year's Al-Shabaab attack on Nairobi's Westgate shopping mall last year that killed 67 people. Al-Shabaab has claimed responsibility for much of the bloodshed and says it will keep up the violence in an effort to persuade Kenya to pull its troops out of neighboring Somalia. Announcing Kimayo's resignation at a news conference, Kenyatta urged Parliament for a speedy approval of his new interior minister.
I held a meeting with the Inspector General of Police, Mr. David Kimayo, a man who has served this nation with dedication and commitment. Mr. David Kimayo offered to retire, and I have accepted the retirement request. I therefore take this opportunity to thank Mr. David Kimayo for his many years of service to our nation. Further to this, I have today nominated the Honorable Major General Retired Joseph Ngaiseri as the new Cabinet Secretary for Interior and Coordination of National Government. I hope that the National Assembly will expedite the process of his vetting and approval.
Kenyatta said his government will pursue the militants.
Terrorism and violent crime are a grave threat to our nation. We are in a war against terrorists in and outside our country. With the aid of sympathizers, supporters, and collaborators among our communities, terrorists have retaliated viciously to deter us from our determined, effective, and successful effort to rid the Horn of Africa of terrorism and violent extremism. We will not flinch or relent in the war against terrorism in our country and our region. We shall continue to inflict painful casualties on these terrorists until we secure our country and region. Our stability and prosperity depends on a secure neighborhood, and this is our commitment.
In Tuesday's attack, gunmen crept up on dozens of workers sleeping in tents at about 1 a.m. local time and killed 36 people in the same area near the Somali border, where a bus was hijacked just over a week ago and 28 passengers killed. Inspector General of Police David Kimayo said he had made a decision to retire early due to personal matters.
This morning, I've been able to make my decision, or my early decision, to be able to officially retire from the National Police Service with immediate effect as we continue forward for our country. This has been prompted by personal matters, and I have discussed with His Excellency the President, and he has accepted my early retirement asked the Inspector General of the National Police Service.
Al-Shabaab have been driven out of several strongholds in Somalia by African Union and Somali troops this year. But analysts said it would not prevent the group from carrying out guerrilla-style attacks or striking abroad.
Our problem with Al-Shabaab did not begin because we were in Somalia. It began because they came to attack our national economic interests. And so we went to Somalia to ask them to stop doing it. So whether we stay there or not, they'll still attack us.
As with past attacks, Al-Shabaab militants said they were pushing Kenya for sending troops to join African peacekeepers battling the Islamists in Somalia. In a statement, it put the death toll at 40 and called the victims Kenyan crusaders.
Now, 2 months ago, the United Nations set a target of having 70% of Ebola victims buried safely and 70% of Ebola patients treated in isolation beds within 60 days. 2 goals which are seen as key to halting the spread of the deadly epidemic. But unfortunately, those goals haven't been met, and we'll see why in this next report.
After taking stock, the United Nations was optimistic. Targets would have been met in Guinea and Liberia by December the 1st. But clearly, that has not been the case, as the virus has continued to spread.
When UNMIR was deployed, we asked some of the best disease epidemiologists to try and help us understand where we would be on December 1, what kind of caseload we would be facing. And for planning purposes, the scenario that they projected was up to 10,000 new cases per week across the 3 countries. We're at less than 1/10 that.
The UN Health Agency did not provide any explanation for the abrupt increase, but the figures published on its website appeared to include previously unreported deaths. Sierra Leone does not yet have enough beds in treatment centers to isolate Ebola patients, but the UN says overall, the tide of the disease is being turned.
We have exceeded those targets in most cases. In the case of safe burials, those targets are met or exceeded in all 3 countries. In the case of the isolation facilities, 70% of the new cases being isolated, those targets are met or exceeded in 2 of the 3 countries, in Liberia and Guinea, and they are being exceeded in many places in Sierra Leone.
Over 16,000 people have been diagnosed with Ebola since the outbreak was confirmed in the forest of remote southeastern Guinea in March. That's according to the WHO data that covered the 3 hardest hit countries. Guinea, Sierra Leone and Liberia have accounted for all but 15 of the deaths in the outbreak, which has touched 5 other countries, according to the previous WHO figures.
Numbers of people newly infected with Ebola still vary greatly each day, slowing down in some districts and increasing in others. The distribution changes from week to week, and the situation can worsen unexpectedly.
Meanwhile, thousands of people have been mobilized in affected countries to try to track down everyone who has been in contact with each Ebola patient. For instance, these health workers are attending training on Ebola in Porto Loco in the northwest of Sierra Leone. This is one of the rural parts of the country greatly affected by the Ebola virus outbreak. And after training, the healthcare workers will be posted at community care centers set up to cater for people infected with the deadly virus. The teams undergo thorough training in infection control and use of personal protective equipment, or PPE. The centers are designed to take 8 to 12 patients who are admitted in different sections depending on the status of their illness. Dr. Martin Comican, an infection prevention and control expert with World Health Organization, has been conducting training sessions for the health workers.
So before the community care centers open, there's a period of about 3 days training, so they get trained in something about the background of the virus and how it makes people sick and how it spreads. And then there's a lot of very practical training about how to do hand hygiene, how to put on and take off. The protective equipment is quite complicated, and the routine for putting it on, and especially the routine for taking it off, is very particular. And so what we do in the training is we get people to stand up and practice putting on the suits and practice taking off the suits.
The fight against Ebola requires large numbers of trained staff able to work safely in challenging conditions. Training for doctors, nurses, hygienists, community volunteers and burial teams are among the programs being run in the Ebola response. To combat rural cases, health workers need to deploy rapid response units complete with specialists and equipment that can be flown by helicopter to remote villages at the first sign of the disease spread.
We initially bring people here to train nationals. When these nationals are trained, they become trainers on their own, and then they train other people. So this is how we can scale up, and this is a snowball effect, I would say. And so there are more and more nationals that will be trained, and this is how we will maintain the sustainability. We will ensure the sustainability.
Such efforts helped to shut down outbreaks in Nigeria and Senegal, but the worst-hit countries still have deeply unreliable data, with Liberia erroneously adding about 1,000 deaths to the latest figures published at the weekend.